It's 7 o'clock. This is Sky News Breakfast. Our top stories this morning. A fresh blow to Boris Johnson's leadership. His Brexit Minister quits over new COVID restrictions as Omicron sweeps the country.
The lack of steadiness in the cabinet is what's led to David Frost making this quite extraordinary decision on a Saturday night.
The latest warning to the government from scientists: bring in new restrictions now or see hospitals overwhelmed in the new year. British travellers entering Germany will face quarantine on arrival from Monday as the Netherlands enters its own lockdown to curb the spread of Omicron. Adele and Ed Sheeran lead the pack as the Brit Awards unveils its new look nominations list, doing away with male and female categories. The weather: a dull start for central, southern and eastern areas, but some sunny spells in Scotland, northern England and West Wales. And as a 7:45, we'll be taking a look at your Sunday papers with the editor of Spite, Tom Slater, and anthropologist and broadcaster Marianne Ohota. Hello, good morning. Welcome to Sky News Breakfast. Boris Johnson's government has been dealt another blow with the resignation of one of its senior cabinet ministers. Well, the Brexit Minister, Lord David Frost, cited high taxes, net zero commitments and more recently COVID regulations as reasons he's unhappy with the direction of government. And this comes as the Prime Minister faces pressure from scientists to introduce tougher measures to contain the spread of the Omicron variant. And after a rebellion from his own MPs against new rules. Well, Lord Frost's resignation has caused disquiet among Brexit-supporting Tories, particularly as negotiations with the EU over the Northern Ireland Protocol reach their final stages. Our political correspondent Rob Powell has more.
Not well known publicly, but Lord David Frost was a crucial part of Boris Johnson's government. In charge of the Brexit talks, he negotiated the withdrawal agreement and the trade deal with the EU. But he's now resigned, citing unhappiness with high taxes, the focus on net zero and COVID restrictions. In his resignation letter to the Prime Minister, Lord Frost said, "You know my concerns about the current direction of travel. I hope we will move as fast as possible to where we need to get to, a lightly regulated, low-tax entrepreneurial economy." While on the COVID rule changes, he said, "You took a brave decision in July against considerable opposition to open up the country again. Sadly, it did not prove to be irreversible." At the end of a rocky week for Downing Street that's seen a backbench rebellion and by-election loss, this was the last thing the Prime Minister needed.
This is just the latest example of the government just being all over the place, not just on Brexit, but on COVID. And I think the lack of leadership, the lack of clarity, the lack of steadiness in the cabinet is what's led to David Frost making this quite extraordinary decision on a Saturday night.
Lord Frost's exit also throws the ongoing Brexit negotiations into uncertainty. Talks are due to resume with the EU in the new year, amid briefing that the UK could be about to alter its position on Northern Ireland. What Boris Johnson does next matters. Lord Frost was seen by Brexiteers as a guardian of Brexit. If he's replaced by someone who's perceived as a softer touch, then that could anger the very MPs who are already beginning to lose faith in the Prime Minister. Already leaked WhatsApp messages show anxiety among some Conservatives, with one describing Lord Frost's exit as a disaster and another saying it's a hammer blow to the Prime Minister.
Whoever takes over now is going to have to be just as strong and just as tough with the European Union, because the European Union is not going to give in on this unless they really can show that the United Kingdom government means what it says.
Boris Johnson goes into Christmas week hobbled on many fronts and faced with tough decisions over COVID regulations. For now, ministers seem intent on waiting for more data before potentially tightening restrictions. But events have weakened the Prime Minister at the worst possible moment. Rob Powell, Sky News in Westminster.
Well, scientists have issued a fresh plea to the government to bring in tougher COVID restrictions within days to stop hospitals becoming overwhelmed. Scientists on the SAGE advisory group say that there are now hundreds of thousands of daily infections and are warning that the numbers of hospitalisations from COVID is likely to peak in January, as well as over 3,000 every day, even with the current Plan B restrictions. And all this against the backdrop of growing calls from an already beleaguered hospitality industry for more financial support as the sector faces yet another Christmas impacted by the virus. Sky's Emma Birchley reports.
Saturday night before Christmas, and pubs and restaurants would usually be packed. Instead, the streets of Chiswick were half empty. It seems the threat of Omicron prompted people to vote with their feet. But senior government scientists are convinced the only course of action to prevent hospitals being overrun is to remove the choice and return to the kind of restrictions seen during lockdown.
The number of cases we're seeing reported are probably the people who got infected about maybe a couple of days ago. And these are the people, unfortunately, some of them will then start getting admitted into hospital in about a week's time. So whatever decision is made, say today, that will start to see the effect on hospitalizations probably in about 1 or 2 weeks' time.
Earlier this week, MPs voted in Plan B, enforcing mask wearing in most indoor venues and the need for proof of vaccination or a negative test to get into nightclubs and large events. Working from home was also advised. But now the pressure is on the government to come up with a Plan C, and fast.
The scientists have warned a significant reduction in transmission is needed to keep hospitalisations below previous peaks, with admissions expected to hit more than 3,000 a day in January, unless further action is taken.
It's understood experts who advise the government believe there are now hundreds of thousands of infections each day. And once again, the biggest risk factor is deemed to be mixing with others indoors. At the pilot pub and restaurant in Chiswick, the function room remained empty all day after 2 events were cancelled at the last minute.
It's pretty terrifying, basically, for myself, all of my staff, really. All of us are unsure as to what's going to happen. In the past, we had the furlough scheme, and at least that could guarantee that people were receiving money, basically. If they're not willing to offer us that, I'm terrified, basically.
There was a sense of resigned inevitability among those who'd ventured out.
We'll be in for another lockdown, I reckon. We might be after Christmas or after the New Year.
It wouldn't be what I wanted to happen, but at the same time, if it's the right thing to do, I think a lot of people maybe would accept it.
I think if restrictions are the way that we need to go, then that's what we have to do, right? It's depressing, but it's true.
Further restrictions would give more time for boosters to be given, and a further £22.5 million has been allocated to target areas of low uptake. The government says it'll keep its measures under review based on emerging data. But listening to the scientists, it doesn't bode well. Emma Birchley, Sky News, West London.
Well, the British Medical Association has warned that almost 50,000 doctors, nurses and other NHS staff in England could be off sick with COVID-19 by Christmas Day if the government does not introduce further measures to stop the spread of Omicron. Well, let's get more on this now from Milena Veselinovic, who joins me from the newsroom. Milena, some strong warning there to the government. And of course, we know the government appears, on the face of it anyway, reluctant to introduce any new tougher restrictions. But the question is, are we delaying the inevitable?
So far, the government is reluctant, but these are some very strong words from the BMA following up the SAGE comments that we've heard. And what the BMA says is that they basically compared the current case numbers and trends and applied that to the workforce of the NHS in England and came up with several scenarios, and worst of them being that there could be as many as 130,000 NHS staff in England off sick. That's 1 in 10 of the workforce workforce in England. And what the BMA says is that could have horrible consequences on the care provided to people by the health service, and not just patients who have COVID-19, but it will also affect urgent care and also treatments for other patients with other serious conditions. Now, what the BMA says we need are further restrictions, because they say that relying on the booster program alone is not enough. Now, in a statement, the BMA's Council Chair, Dr. Chang Nagpal, has said the Westminster government's strategy of relying solely on vaccinations is not enough, is poor public health practice, and is already causing preventable harm not only to the NHS but also to education and the economy. Now, he went on to say if our estimates of staff absence are realised, which we honestly hope they are not, this would be truly devastating, leading to an inability to provide even some of the most urgent services. Now, the BMA is calling for cancelling of large indoor events, the reintroduction of that 2-metre social distancing rule that we used to have, and also crucially sending a strong message to the public to limit mixing right now before Christmas.
Milena, thank you. And there'll be more on the Omicron variant and the prospects of further restrictions on Trevor Phillips on Sunday later this morning here on Sky News. And Trevor's guests today include the Health Secretary Sajid Javid. And you can watch that interview live from 8:30 and also join the conversation with the hashtag Phillips. Well, joining me now is Dr. Simon Clark, who's a microbiologist at the University of Reading. Good to have you this morning. Now, we're seeing for ourselves a rate at which Omicron is sweeping through the country. Do you support tougher restrictions? Should we see tougher restrictions this side of Christmas?
Well, regretfully, the numbers are getting very high. They're increasing faster than I think anybody seriously anticipated a week or two ago. So to keep those numbers down in anticipation of a lot more people turning up in hospital, there probably does need to be a tightening of those restrictions.
And we're just hearing from the British Medical Association, which is warning that almost 50,000 staff could be off sick by Christmas Day if the government does not introduce further measures to stop the spread of Omicron. What are you predicting, looking at the rates of the NHS at the moment?
Well, this is another big question. We focus on hospitalisations and deaths, and I think quite rightly. But the wider effect this has on society, it won't just be the NHS that is hit hard by a lot of people going off sick. If the country is hit by a mass sickness event, then all of the public services, including the NHS, are going to be hit by lots of people going off sick. The police, the fire, councils, and there's going to be a downturn in economic activity from that as well. So it's not just the NHS that's going to be hit, but of course that's an important one to take into consideration.
And what do you make of the data that's coming out of South Africa at the moment, which indicates that hospitals have not been overwhelmed?
Well, hospitals haven't been overwhelmed, but their numbers of hospitalisations is going up and their excess death rate has been going up as well. And we've got to remember that you can't easily translate one country's situation to another. The results of an infectious disease are a function of the people it infects, the bug that's doing the infecting, and the environment. And South Africa has a younger population, and they're in their spring, heading into their summer. So circumstances will be different. And right throughout this, they've had a lower infection fatality rate right from the very go. So their situation is going to be different from ours. And we have to wait and see exactly what's going to happen here and exactly how hard we're going to be hit.
And the government, of course, had a target for the boosters of about 1 million a day, but we're not hitting that figure. Why do you think that is?
I think the infrastructure, and it's worth pointing out that we've never had 1 million a day, even if we had exactly the same setup as we had 9 months ago, 6 months ago, then we probably would be hitting 1 million a day. The infrastructure is simply not there at the moment. And of course, it's worth remembering that if, like me, you're going to get your booster today, mine's this evening, it'll be another week before really immunity starts to become appreciable. And in that time, the numbers of infections will continue to grow.
And what lessons do you think we've learned so far looking at the trend from last year and also looking at this year?
That you need to act soon, not later. And that's why Sage, that's why people like Chris Whitty are as worried as they are. They would rightly be criticised for not having learned the lessons of the pandemic if they just sat around and waited to see what's going to happen before acting.
So with that being said about saying you need to act soon, do you think that the government has acted soon enough this time round?
It seems, given the advice from Sage, that they've acted, but perhaps not acted tough enough.
Dr. Simon Clark, thanks for your time this morning.
You're welcome.
Well, let's take a closer look then at the latest COVID data. And there are now almost 25,000 confirmed Omicron cases in the UK. That's an increase of more than 10,000 in the last 24 hours. And that's 3 times as many as the 3,201 new cases recorded on Friday. Now, although the actual numbers are thought to be much higher. And looking at coronavirus infections as a whole, there have been 90,418 new cases recorded in the latest 24-hour period. Another 125 deaths have been reported within 28 days of a positive test. So this brings the total number of deaths in the UK to 147,173. Now, Omicron is also sweeping through Europe as cases surge. Germany has become the latest country to introduce travel restrictions on the UK. From 11 p.m. tonight, travellers will need to quarantine for 2 weeks and have a negative PCR result to enter the country. It's after officials classify the UK as a virus variant area of concern. That's the highest COVID risk level. Germany's also been reporting around 50,000 infections a day, but the number has been steadily dropping since the beginning of December. Meanwhile, the Netherlands has entered a new lockdown this morning. Non-essential shops, restaurants and schools will all shut until mid-January, and residents can only have 2 visitors other than Christmas and New Year, when 4 will be allowed. Caretaker Prime Minister Mark Rutte said that the measures were unavoidable because of Omicron. And rumours of a lockdown led to a surge in Christmas shopping yesterday, with Rotterdam's mayor saying that the city was too busy and urged people to stay away. So the weather then, what has it got in store for us? Well, let's take a look, shall we?
Look forward to brighter skies. The weather, sponsored by Qatar Airways.
Well, there's a lot of rain, I can tell you that much. High pressure continues to protect us from the Atlantic rain. But, and there's always the buts, isn't there, only for so long. By the middle of the coming week, conditions will become colder and more unsettled. This will be dull to start the day for central, southern and eastern areas with extensive mist, low cloud and fog. The Omicron variant is wreaking havoc across the UK and is threatening to throw the country back into lockdown just as the festive season gets underway. Well, joining me now is Dr. Helen Lawal. Great to have you on Sky News this morning. Are we just delaying the inevitable? Should we have a lockdown this Christmas? Because many people will be mixing, if not.
I think what we have to remember is that we know that vaccines are really effective. We know that they've reduced hospitalisations and death. And actually, the emphasis here is on getting boosted now. So the government are calling on a national mission, encouraging people to step forward to have their first, second and third vaccinations so that we can create a wall of defence against Omicron, which we know is highly transmissible. We know that the rates are doubling at a rate of every 2 to 3 days. And we know that the best protection is for as many people to get vaccinated as quickly as possible. So it now is becoming more urgent and more important than ever that people step forward and get boosted now.
And what the government's struggling to meet is ambition of 1 million booster vaccines a day. What do you put that down to? It's managed 800 last time.
Well, actually, we're reaching the
800,000, I'm sorry. Not 800, 800,000.
Well, actually, we're reaching the 26 million booster mark now. So for me, that's a real positive. And part of the way that we're trying to combat the uptake is by launching a street team. It's an army of vaccine ambassadors which are up and down the country from Newcastle to Brighton, and they're really taking to the streets and interacting with the public, They've got each team has got their own vaccine bus. They're providing information and reassurance for the public, and also there's lots and lots of extra pop-up sites that are happening. Some of them are the vaccine centres. New vaccine centres are also open 24 hours. So we're really trying to make it as easy as possible for people to get vaccinated, and everyone is going to be offered that booster vaccine over the age of 18 by the new year.
And we know that some people are still yet to come forward for a vaccine. Is there a particular group of people?
I mean, part of the way that the street team are working is they're going out and they're speaking 33 different languages. So we're really hoping that any groups of people that perhaps weren't getting the information about the importance of this before are going to be reached. And really, because we're wanting people to have their first, second and third booster vaccines, we're really calling on everyone, even those who have already had a vaccine, to come and get their booster.
And what about age group? Are we seeing a disparity between older people and younger people when it comes to the vaccine still?
Yeah, and I wonder if this is partly due to accessibility. I know that now some of the pop-up sites are appearing in more accessible areas with higher footfall, that we're seeing people present overnight in some of the 24-hour centres coming forward for their vaccines. And so we're really hoping that by making it easier than ever, people are going to step forward from across all age groups, and they can do this by attending some of the pop-up sites, the vaccine centres, booking online at nhs.uk/COVID vaccine, or calling 119. So there really are so many ways to get booked in now for the vaccine.
And do you think we should take a tougher approach to vaccines like Austria and Italy, for example, and introduce vaccine passports, for example?
I think at the moment, we need to really focus on getting as many people vaccinated as possible. And by getting the message out there, what we don't want to do is we don't want to exclude people who haven't yet had their vaccine, who are keen to get it done and maybe haven't found it convenient or maybe haven't had the information. So I think it's really important at the moment that the message remains positive, and that we know that the Omicron is spreading fast. And also we know that the Omicron variant, the efficacy of the vaccine is lower than with the Delta. And that's why people who have already had their first and second vaccine must step forward for the booster, because we know what the booster does is it raises that protection up against above 70%, which is really where we want it to be. So to not become complacent, even if you've had your first and your second, and to step forward to have your booster.
Dr. Helen Lawal, thanks for your time this morning.
Thank you.
Well, a raft of new measures to tackle the Omicron variant have now been announced across Europe in recent days. In Denmark, all cinemas, theatres and museums must close from today. And some of the Danish Queen's Global Jubilee celebrations, which was due to take place in January, have even been postponed. Well, I'm now joined to discuss the situation in Denmark is the chairman of the COVID Variant Assessment Committee, Professor Troels Lillebæk. Thanks for your time this morning. Just bring us up to date then with how the Omicron variant is acting in your country. What's the rate of infection at the moment?
We are still seeing a doubling every second or third day in Denmark. So the other day, we reached 10,000 cases. And you have to remember, we are a country of 5.8 million inhabitants. And we're also seeing an increasing number of admissions every day. So we are a bit worried at the moment.
And what is it that you're doing at the moment? Because you do have some restrictions, don't you? Just bring us up to date with some of the latest restrictions that you have. And do you think that you should be going further?
Yeah, I think just the other day, there was a lot of new restrictions implemented. That's how many people you gather. It's also that people work from home. We have this Corona passport, also restaurants closing early, alcohol. You have to stop serving alcohol at a certain time of the day. So there are many new restrictions. School children are at home now until after New Year's Eve. And at the same time, I think most importantly, the vaccination is accelerated a lot in Denmark. So we're giving people the booster jab. Whether it's enough, I think it takes a while from you implement the restrictions until you see the result on the curves, actually. So it's a little bit too early to say at this moment.
And you touched on the vaccination there. I mean, we've seen places like Austria and Italy who are taking a very tough approach to vaccinations, and they have vaccine passports, for example. Is that something that you would support?
I think in Denmark we have a corona passport, and you can have a green corona passport on the basis of vaccination. That would be the easiest thing because then it stays green. But you could also get tested very frequently, or even if you have had the infection, you will have a green passport for a period of time. But in Denmark, there is a relatively big trust in authorities, and 77% of the population have had the vaccine, and a lot have had the booster vaccine right now. So there is like a general trust in vaccinations in Denmark, and we are using the messenger RNA vaccines in Denmark.
I mean, if you cast your mind back to last year, we didn't have the vaccines, and we've obviously made such a breakthrough having this. We've also got testing, which is accelerated. What lessons do you think that you've learned from last year compared to this year?
Yeah, I think, well, that's difficult. I think we are going to have coronavirus around for a while. And it was a surprise to see a new variant with such a enormous ability to spread. So I think we have to be prepared for a long and hard winter. And what we are doing right now in Denmark is trying to avoid the blizzard. And by blizzard, I mean a lot of people testing positive at the same time, because that would put an enormous strain on the hospital system. Also, the staff will test positive and have to be isolated at home, or even in extreme scenarios that have to go to work anyway, wearing mask protection, because somebody has to take care of the patients in the hospital. So I think we need to be prepared for a difficult situation, and of course also planning ahead. The good thing is we are seeing new treatments that are promising. The vaccines can be changed quite fast, and we also hope that this new Omicron variant is not giving as severe disease, but it's too early to say. Nevertheless, if we get a lot of cases at the same time, it will be a problem anyway.
Professor Truls Lillebæk, great to have your company. Thank you.
You're welcome.
Look forward to brighter skies. The weather, sponsored by Qatar Airways.
Well, high pressure continues to protect us from the Atlantic rain, but not for very long. By the middle of the week, the coming week, conditions will become colder and more unsettled. It will be a dull start to the day for central, southern and eastern areas with extensive mist, low cloud and fog. Scotland, Northern England and West Wales will have a brighter start after early fog clears. Well, with us this morning to review the papers are the anthropologist and broadcaster Marianne O'Hotter and the editor of Spiked, Tom Slater. Good morning to you both. Let's just dive straight into it then, shall we? Marianne, just looking at the front page of The Observer, shows the situation that the government is in, being pulled in all directions, because on one hand, scientists are saying you have to bring in more restrictions. On the other hand, his own government rebelling against Plan B, as we saw. But there is a call to have tougher restrictions, isn't there?
Yes, that's right. So this is the information from the briefing that SAGE, the Scientific Advisory Group for Emergencies, the group of scientists who are advising the government ministers about how to tackle COVID and the Omicron wave of cases. That's come out into the public, and they've basically said the models suggest that there could be up to 2 million new infections every day. The models from kind of best case to worst case scenarios, and bear in mind these are models, not predictions, could be between 600 and 6,000 deaths a day caused by both the Delta variant, which is still epidemic proportions levels of infection within the UK, but also, of course, Omicron on top of that. One consideration is, of course, that number of sick people can't be looked after by the NHS. Our health and care system will be under crippling pressure and not cope. But the other side of that is that if we allow infection levels to transmission between people in the community to be that high, then you end up the country grinds to a halt, because you don't have enough people who aren't infected to be able to keep those key systems running. The postal services, pharmacies, people delivering groceries, opening shops, all that kind of stuff, that is important. People going to look after the sick, the vulnerable, the elderly, all those folk who need help just to be okay each day. So the question is, if we listen to that very vocal, but some people have described as ignorant group of politicians who are kind of perhaps sounding off for political gain rather than for public benefit, saying we don't want this, we don't want curbs to our freedoms, we don't want to let Omicron have to win, we want to maintain our freedom. The question is, well, what are you giving freedom to then? You're giving freedom to Omicron to effectively destroy the country, destroy our health and care system. Learning to live with this virus doesn't mean ignoring it and carrying on regardless. It means learning to adapt and live with it in that respect. We can't pretend it's not there. We can't pretend it doesn't have an impact. And so the question is, do you want to listen to politicians who are, yes, democratically elected, but not scientific experts? Or do we want to listen to the scientists?
Well, there's one thing that the scientists are definitely pushing for, and also government, which is the booster. So at least on one page there. And we'll stay with the Observer, Tom, because this is about the booster walk-in centres, not enough to deliver the boosters.
Yes, so in this report, and the Observer points out that large swathes of the country, including some major cities, have no walk-in centres whatsoever. So places like Norwich, Peterborough and York are mentioned here, which is a particular problem, not just at the time in which you're trying to roll out boosters nationwide, but also in terms of particular hard-to-reach pockets of the population, immigrants, undocumented workers, people of this nature who won't necessarily have contact with a GP. I mean, this is obviously a tragedy because of how effective these boosters are. These really are long-term, our way out of the pandemic. The rollout was already pushing down very significantly on hospitalisations and deaths at the point in which even before Omicron came along. And this is something which the government certainly has to look at. I mean, if I might just come back a little bit on what Marianne said there very quickly, I think one thing that's worth bearing in mind is the key word here in relation to what's coming out of Sage and the rest of it is models and scenarios, right? If you go on the Spectator's data hub, who have been tracking all this throughout the past few months, they have a dreadful track record in terms of predicting what's going to happen with hospitalisations and deaths, because they're trying to predict the future. This isn't about data in the here and now, and they present often worst case scenarios. That's something which has come out quite clearly. Neil Ferguson was predicting 100,000 cases a day in the wake of the summer reopening. We never got anywhere close to that. And whilst we could dismiss this idea of civil liberties as if it's unimportant, it is fundamentally important, especially given the fact that we do have to learn to live with COVID. We are going to have new variants. If even in the situation where we have a lot of immunity in the population, that we still have to lock down just in an abundance of caution, this will literally never end. And I think that's just important to grasp as we go into this quite bleak period, it feels like.
Absolutely. So much to juggle, isn't there, with this? As you mentioned, the civil liberties, health of the nation, the NHS, the economy as well. Let's just step away from COVID and let's move on to other stories, because the front page of The Sun, Marianne, it's, it shows some, concerns that the Queen has. At first glance, I thought she just didn't want William to be using the helicopter, But actually, there's a serious reason behind that, isn't there, why she doesn't want him to be using the helicopter?
So this is the news, like you say, as a kind of slightly grim palate cleanser from all the chat about COVID, that the Queen has apparently raised concerns with Prince William about him travelling with his whole family, so Kate and the 3 children, in helicopters, because I mean, I've never been in a helicopter. Oh, no, I have. That's a lie. Most of us don't travel every day in helicopters. But, we all kind of know that as a track record, when something goes wrong in a helicopter, it goes catastrophically wrong. And so the concern is that if there were to be a crash, then not only would the Queen lose her grandson and 3 of her great-grandchildren, also the succession to the throne would be thrown into disarray, because if you've got Prince Charles, but then you've got William and George and Charlotte and Louis, and if they all die, it's horrible to talk about, but if they all were to die, then the next person in the royal succession would be Prince Harry, in principle, except he's resigned from being a royal. And Harry's children, Lilibet and what's his name, Archie. So at that point, it's the Duke of York, who is not anyone's favourite royal by a long stretch of the imagination.
Well,
So not only is the Queen concerned about, looking after the safety of her family, it's also what would happen to the royal family if something were to go very badly wrong.
Absolutely, my goodness. And when you mentioned that helicopter disasters, I thought of Kobe Bryant, who, of course, had, died in that circumstance. Absolutely horrific. This is something that, touch wood, we hope doesn't happen, that everybody stays safe, of course. Let me come to you, Tom, because this is a story that many people will be waking up to. Lord Frost resigning.
Yes, so a huge bombshell overnight. It was the Mail on Sunday's scoop, actually, came out last night, that Lord Frost, the Brexit Minister, is resigning. He had actually tendered his resignation earlier, but but Number 10 had basically talked him into staying on until January because, given all of the scandals enveloping this government, they didn't think they could take a high-profile resignation. This scoop has effectively forced his hand. He's issued his resignation letter. It points towards disagreements with the government on various different elements of policy, particularly COVID policy. Vaccine passport seems to be a key thing. Tax hikes being another thing that seems to have upset Lord Frost. The story in the background, which isn't really being touched upon, is the fact that whilst we've all been focusing on COVID, it's become pretty clear that the government appears to be about to backtrack and capitulate in the negotiations with the EU over Northern Ireland on the question of the European Court of Justice, which is a very big red line for Lord Frost. I think it just adds to this sense that this Prime Minister is very much in battles, has fewer defenders than he ever has done, and that general sense that whilst the pandemic would have blown any government off course, to put it lightly, it seems to have blown any sense of principle or substance out of this one. You've seen one U-turn after another on all kinds of different elements, and some of the people who were very key to this Johnson administration have clearly had enough, as we've seen with this.
Absolutely. It's just another blow, isn't it, for Boris Johnson's government? North Shropshire obviously thrown into the mix, the party scandal also thrown into the mix. So there's a lot for him to worry about, and a baby possibly crying throughout the night as well, as if he hasn't got enough on his plate. Mariana Hotter and Tom Slater, great to have you with us this morning. Thank you so much for your company. And, of course, we'll be back after this short break.